said, I will present to you the European Care Strategy, which is overarching, let's say, Commission policy paper that we have put together last year in order to set a common EU vision on what should be, let's say, the building blocks of affordable, high quality and accessible care systems. So it all started in 2021 with our president, Ursula von der Leyen, who made this commitment also as a follow-up to the COVID pandemic, that the Commission will come up with a European care strategy that will put the spotlight on how men and women can find the best care and best life balance for them. Then, in terms of what it entails, we have what we call a Commission communication, which sets a number of actions at European level, but because we are in an area where actually responsibilities lie mostly with member states, we also put forward proposals for the Council and member states to negotiate on, we say, Council recommendation. These are non-legally binding legislative instruments, and one focused on long-term care, and one focused on targets for participation in early childhood education and care. In my presentation, I will focus mostly on long-term care because I think this is also the scope of your activities. So I wanted just to give a quick recap of where do we stand in Europe with our care system and why we need a care strategy. So we see that there are many failures in the system. Mostly there are not enough care services, neither for children, neither for older people. And this has a strong impact on women, especially because they are the ones that provide care, unpaid care. And we have about 7.7 million women who are out of labor market because of their care responsibilities. We also see lots of inequalities in the system, because it is precisely the children who come from disadvantaged families, but also older adults with low income that are the ones that need more care and can afford, or their family can afford least the care that they need. We are also an aging society. You mentioned the numbers will explode. And already now, actually, we have more than half of the people in need of long-term care who do not have access to care services. And I think also from the perspective of the Directorate General for which I work, DG Employment, we see that in addition to these challenges, there are lots of potential for the sector, especially with regards to job creation, because there could be many more jobs in the sector to already satisfy the ongoing demand, but also to meet the future demand driven by aging population. And you have here a number that we would need about 1.6 million extra care workers only to keep the current level of offer, which is actually very low. So what are the key messages in the care strategy? So it really takes this lifelong perspective, highlighting that in all our stages in life we need or we provide care, or we need care for our loved ones around us. It also highlights how much the COVID crisis actually revealed the structural weaknesses, the significant underinvestment and lack of attention to staff working conditions, and the impact it had both on workers and on those in need of care. It also highlights the challenges that I mentioned with regards to low level of services that are being available, or poor quality of these services, or high prices and unaffordable, and also for people with disability, the accessibility challenge. It also highlights a bit the multi-gender dimension, so women withdrawing from the labor market, therefore also having lower incomes. Women tend to live longer, so they will be the ones needing care later on, and even higher, longer, more intensive care needs, and then being least able to afford because their salaries, their revenues throughout their lives have been lower. It also stresses a lot the importance of good working conditions, and I will come back to that in a minute. and then also the socio-economic costs of lack or poor quality of care systems. What was quite important for us from the very beginning is that we take in the perspective both of people in need of care and those that provide care. And when we talk about those that provide care, we mention both those that are formal workforce, so they work in the sector, but also what we call the informal carers, so the family members, the friends that provide care to their dear ones. And then this lifelong perspective that I mentioned. Then what was also important is to acknowledge that care is not existing in a vacuum. Actually, it's somehow embedded in every element of our society. So the way we design our employment policies, our social dialogue policies, our healthcare policies also impacts how our care systems are designed and working. And we have a number of building blocks. For example, the 5 that are mentioned, listed here. First and foremost, the drive to improve the care services, both in terms of, let's say, number, availability, what's on the offer, but also in terms of the quality of and accessibility and affordability of these systems. Improving working conditions, and here we stress a lot the role of the social dialogue and collective bargaining, and also for people with care responsibility in their private life, how to improve the work-life balance. Also, we touch upon, let's say, the issue of investing in care, so trying also to put some evidence on what are the return of investment, maybe with stronger focus on the social return on investments, and how to improve the evidence-based and monitor progress in this sector. So quickly, as I mentioned, on services, all these dimensions that we want to tackle, and because also while we were preparing the care strategy, there were lots of revelations in the press about different poor or even appalling practices in some residential care centers in some of the member states. There was very strong impetus to drive and hammer very strongly the hammer with regards to the high quality. So the communication makes it clear that, at least from the Commission perspective, there should be high quality standards in care that should apply equally to public and private providers, and then they should also be underpinned by quality assurance, enforcement, and monitoring practices, and also acknowledging the gaps that are already existing in the system. Now, quickly, in this slide, you have a number of actions that we are rolling out to underpin implementation of the care strategy. I will focus mostly on the workforce. With regards to working conditions, we provide ample evidence, and we rely actually lots of data that we have from Eurofound. Also, just 1 hour later, I will join OECD for a panel on precisely the challenges of the long-term care workforce. So we see low pay, very low pay compared to other sectors. We see difficult working hours, working patterns, also contracts that do not offer enough labor rights or social protection rights. And this, of course, affects a lot the attractiveness of the system. And this is why no matter if we talk to Sweden or we talk to Romania, all the member states are complaining that it's very difficult to find staff to work in the sector. So here, of course, at EU level, we made a proposal for a minimum wage directive, and we hope that this will also help with improving wages in the sector. And we are actually following some negotiations between social partners, supporting them to set up a sectoral social dialogue for social services. And this will also include the care sector. Because we are under the umbrella of the European Year of Skills this year, this also brings ample opportunity to mobilize all the various skills initiatives that we have at EU level to put the spotlight on the care sector. And actually we have a very large partnership that has been found by social service providers, by vocational education and higher education institutions, regional authorities, and social partners to focus on skills developments in the sector, especially with regards to person-centered approach to care and with regards to digital skills. Just to say that in each member state, we are setting up a network of what we call long-term care coordinators, which are designated by their ministries, and they actually have the responsibility to coordinate long-term care actions in their countries, but also to come together at European level. We are providing for them various mutual learning opportunities, addressing all these different dimensions of quality, improving working conditions, social protection for long-term care, and so forth. We are also launching a strategic partnership with the World Health Organization because they do a lot of work on integrated care, so integration between health and long-term care. And we want to tap on their expertise and also on their networks. And we continue working very closely with OECD, with whom we have a long-standing project on social protection for long-term care. So trying to measure a bit the adequacy of the benefits that are being offered for covering long-term care, so either benefits or services in different countries. As I said, the main message of the care strategy is not as much that there are many challenges in the sector, but also that it's worth investing. And actually by investing, you bring multiple dividends, both to individuals in need of care, to carers, and economic and to society. We also make very clear in the communication that long-term care services by the nature are a public good, and that investments, public support needs to be step up. We give some pointers as to how to contain the costs, because we think that indeed the costs are bound to explode given the number of the increase in older age population. But by investing more in prevention, for example, in integrating care and health, long-term care and health care, and also developing much more home care services, you can also bring more cost effectiveness to the system. Then we also highlight the vital role of social economy organizations and of local and regional authorities in designing and providing care services, because they are really the ones closest to the communities and that are very well placed to provide such services. And again here, quite important, again, the call that all the investments in long-term care should take place in a clear regulatory environment, and also need to uphold a certain number of quality criteria, including the rights of persons in need of care and the working conditions and wages for staff. And now quickly with regards to what is the homework for member states. Again, a non-legally binding instrument, but actually which went very smoothly through the negotiations, because I think all member states felt that they have these common challenges, and this is an area where we see many reforms and measures being planned. And here basically they took the commitment to improve social protection for long-term care, ensure its adequacy, so basically that at the end what the state would cover through different financing means would ensure that people do not fall into poverty just because they have to pay their share of long-term care costs. Also quite a strong message to significantly expand the offer of care, but to have a good mix between high quality residential home care and community care, with also a focus on closing territorial gaps, because we know there are many disparities across regions. tapping into innovative digital solutions that enable independent living and also the accessibility dimension. Then there is a strong focus again on the quality and different calls with regards to how to improve working conditions, basically wages, high occupational health and safety standards, social dialogue skills, legal migration pathways, and so forth. On quality, the basic principles is that each member state should have in place a long-term care quality framework, which should apply to all long-term care settings and providers, no matter if public or private, and equally, let's say, regions, municipalities. It should be based on a number of quality principles which member states have agreed upon, and also be underpinned by some quality assurance elements. So the principles, they come as an annex to the Council recommendation, and they very much focus on the perspective of the persons in need of care and the caregiver, so respect for human rights, dignity, independent living. Also a focus on how to limit, let's say, the onset or the aggravation of the frailty medical condition, and to support rehabilitation and prevention, how to adapt the care offer to the needs of the person in need of care, and also to cover all care needs, because in many countries, for example, the systems are so fragmented that you only get coverage for part of your needs. And also how to ensure continuity. So, for example, if you are in a home care and your family member goes away, how you have some support that the person can continue to be in the home care or in a daycare center, and so forth. Focus on the outcomes, and here there is a trend from moving on from the strict medical outcomes to also more outcomes linked to the well-being of the person. Also a principle linked to transparency, that it should be very easy to find information about what kind of care services, facilities are available and how you access them and what is the social protection coverage and so forth. Then with regards to workforce, respect for working conditions, social dialogue, appropriate staff ratios, and compliance with labor law and social protection rights. And also that the facilities themselves where care services are provided should be compliant with all relevant legislation. With regards to the quality assurance, here again, the same, let's say, principle applied to all settings and all providers. What's also important that indeed the recommendation stresses the enforcement, but also, let's say, a collaborative approach to enforcement, that there should be a cooperation between and incentives between care providers and state authorities that push care providers and help them to go beyond the minimum standards. There is also a requirement to have in place at care provider level a dedicated budget for quality management, and for the countries where public procurement is being used, also that this is underpinned by all the quality principles. And then again, recall for the respect to independent living, freedom to choose between different care settings, and protection both for caregivers and care receivers from all forms of abuse and neglect. So I think that was it from my side. Here you have a link to the care strategy, and this will take you later on to a number of other documents. Also, we have some analytical papers and some statistical data for any of you that would be interested in more. Thanks a lot.